Good afternoon. It's Wednesday, time for Wisdom Wednesday. Going to circle back to some of the information that we briefly covered a few weeks ago on estradiol, as I'm still reeling from all the hormone meetings that I've been doing in the last 6 weeks. I've been to part 2 of my hormone courses, part 3, and then we had our update meeting in the middle where I had an opportunity to speak about mitochondria and mitochondrial dysfunction and a little bit about cellular biology. But I wanted to circle back on estradiol because I still think that, and still have patients coming in every week very concerned about using this particular hormone and perhaps its risks. And I thought I would walk through a little bit of some of the newer data that's coming through that is actually showing estradiol as really one of the few things that actually clears plaque in our blood vessels. There's very little out there that does that. You know, so many people are having to have either bypass surgery or having balloon plasties done that are opening up coronary vessels in the heart. And it is really interesting when you look at some of the current literature and even some of the older literature that we have seen and continue to see that estradiol actually helps to clear plaque. And the ways that estradiol can do that is certainly through several mechanisms. But firstly, we know that the only 2 things that raise HDL in any significant way is exercise and estrogen, estradiol in particular. So when my patients who come in have low HDL and certainly have high triglycerides, one of the first things we do obviously is look at diet, but we also look at estrogen as a way to help raise HDL, because you really want to have that triglyceride to HDL ratio be, well, optimal is less than 1 or around 1, but at least for most of us, at least less than 2 to 1. So, but I really like to see that triglyceride low and high HDL, which really tells us that there's good metabolic types of work happening within the body. So it raises HDL, and this is known as, of course, the good cholesterol, you know that, but it helps to remove LDL from the arteries, and these levels in and of itself, with the use of HDL, help to clear plaque. It also reduces inflammation, and lowering inflammation will also lower the way that the LDL particles can burrow into the endothelial lining, the lining within those blood vessels, which is the process of building up plaque. These anti-inflammatory responses with estradiol will then also reduce plaque. It seems to help vascular function in that it helps keeps the blood vessels healthy and elastic so that they are very pliable and that they are able to dilate and constrict as they need to optimally, as we did when we were younger. And not only does it reduce plaque, but it stabilizes plaque. So it decreases the rupture of plaque, which is what really sets us up for strokes and heart attacks. So that is exceedingly important. So it really works in several ways. As you can see, it works on the HDL particle, it works to reduce inflammation, it works to improve vascular function, as well as stabilizing plaque. In addition to this, it also limits platelet aggregation, and the platelets are those little cells within our blood that cause the blood to clot. And so it reduces clotting of blood. And in addition to that, one of the underlying things that is setting us up from a metabolic standpoint for having issues with plaque buildup is insulin resistance. And estrogen can definitely help improve insulin sensitivity. So all of these things taken together can make a huge difference in our cardiovascular risk. And we know, and we are seeing that more and more women are having heart attacks. And when women have MIs, they're more likely to die. And so it's very important that we recognize the signs and symptoms, not only of coronary insufficiency, but that we do all that we can from a preventive standpoint. And hopefully as we move on, I'm just now getting through Peter Attia's Outlive, and the idea that he is talking about in his book, going from medicine 2.0, which is mainstream medicine today, which is to make a diagnosis and treat it, going to 3.0, medicine 3.0, which is preventive. And any and all things that we can do to prevent heart disease, which is the number one killer that we have, is to utilize the tools that at hand. And estradiol is absolutely one of the very few things, if any other things can do it, is to remove plaque. And plaque is that thing that stiffens our arteries and can rupture and can cause blood clots and then limit blood flow to our brain and to our heart, which then can really produce significant illness and mortality. So I hope that's been some good information for you. I just want to continue to share those things that continue to come up in terms of newer and more explicit data and studies that are out there showing the true benefits, and hopefully mainstream medicine will catch up with us. Hope you all have a great week, and we will talk again next week.